Welcome to the Healthcare Authority presentation on Apple Health Medicaid eligibility and COVID-19. In this presentation, we will cover the following topics: COVID-19 updates, self-attestation, change of circumstances and income reporting, Alien Emergency Medical or AEM, Apple Health terminations, renewals for Apple Health, Washington Apple Health for Kids with Premiums or Children's Health Insurance Program, CHIP premiums, Apple Health for Workers with Disabilities or HWD premiums, and resources. COVID-19 updates. In response to the public emergency surrounding the outbreak of COVID-19, the Healthcare Authority is taking steps to ensure individuals maintain their Apple Health coverage. Federal and state authorities continue to provide guidance on how to respond to the COVID-19 emergency. As Healthcare Authority receives clarifications, updated guidance will be shared with the stakeholders and community partners. The Healthcare Authority strives to deliver important information to partners and stakeholders, especially in times of rapid change. Stay informed by viewing updates posted to the Healthcare Authority COVID-19 webpage. Also, please subscribe to the Healthcare Authority Gov Delivery to stay informed and receive important information. If an individual was visiting Washington State, became sick and is now quarantined here, they may qualify for coverage and treatment for COVID-19. Call Healthcare Authority at 1-800-562-3022 to find out. Self-attestation. Individuals can self-attest to their income and resources when applying, renewing, or reporting a change of circumstances for their Apple Health coverage. Applications can be approved and renewals can be processed based on attestation of income, resources, and available electronic verification systems. If an individual is unable to provide verification due to COVID-19, Healthcare Authority will accept attestation of income when processing retro. Change of circumstances and income reporting. Individuals will not lose Apple Health coverage or have a decrease in benefits during the emergency unless they move out of a state or request termination. This includes individuals who had Apple Health as of March 18, 2020 and new enrollees. During the emergency period, individuals who are active on Apple Health should not report any income changes. Changes that should continue to be reported are pregnancy due date, change of address, household size, and loss of income. The CARES Act created 3 federal benefits related to income. These are the stimulus checks, the federal pandemic unemployment insurance, and the expanded and extended unemployment benefits. Only the expanded and extended unemployment benefit is countable for Apple Health coverage. Individuals who are submitting a new Washington Health Plan Finder application should report all countable income, including the expanded and extended unemployment benefits. The stimulus check and the federal pandemic unemployment insurance of $600 per week should not be reported when submitting an Apple Health application. If an individual does not want Apple Health, they should contact the Washington Health Plan Finder for assistance. Alien Emergency Medical or AEM. AEM is a program for individuals who have a qualifying medical emergency and do not meet the citizenship requirements or are qualify individuals who have not met the 5-year bar. Emergency rooms visits, inpatient hospital stays, outpatient surgery, dialysis, cancer treatment, and anti-rejection medication may be considered a qualifying emergency. See WAC 182-507-0115 for more information. Due to COVID-19 pandemic, the Healthcare Authority has filed an emergency rule to include the assessment and treatment of COVID-19 provided in any outpatient settings such as office, clinics, mobile, and non-hospital based settings. This includes the telemedicine, online, or telephonic services. Medications, medical supplies, and follow-up visits may be covered in the following situations. Upon presentation for testing when medications or supplies are determined to be medically necessary for care while waiting for COVID-19 test results, or following a positive test for COVID-19. Following discharge from an inpatient admission due to COVID-19, up to 2 follow-up visits in any outpatient settings will also be covered. This slide shows the AEM fax cover sheet. It now includes the COVID-19 option in the Applying for Coverage section. Individuals who request additional time to provide verification due to circumstances related to COVID-19 may be granted an additional 30 days to provide verification. Individuals who require additional time and keep in contact with Healthcare Authority may request additional time on a case-by-case basis. Healthcare Authority will be flexible with individuals on what types of verification they are able to provide during the time of the emergency. Eligibility workers will continue to verify individuals who have an unverified citizenship or immigration status and/or a missing or unverified Social Security number per federal regulations. Reasonable opportunity periods will be granted consistent with federal regulations. Let's review some scenarios. Scenario 1. Telehealth and telemedicine. Sarah currently doesn't have health insurance, but she thinks she has COVID-19. She has a telehealth appointment with her clinic's doctor. He orders a COVID-19 test, and after the appointment, the clinic's navigator helps Sarah to apply for AEM. What are the next steps in the process? The process for AEM remains the same. Sarah and her navigator will submit the treatment notes from her appointment with the AEM fax cover sheet and select the COVID-19 checkbox. Scenario 2. Inpatient hospitalization. Chris was hospitalized due to COVID-19. After he is discharged, the navigator helps him apply for Apple Health. Due to his immigration status, he is pending approval for AEM. What are the next steps in the process? The process for inpatient hospitalization for AEM remains the same. Chris and his navigator submit the history and physical discharge summary in the UB04 form with the AEM fax cover sheet. Scenario 3. Emergency department. Bill goes to the emergency room because he is really sick. The physician suspects that Bill has COVID-19. He is treated and discharged. What are the next steps in the process? The AEM process for emergency department visits remains the same. With the help of his navigator, Bill applies for AEM and submits the UB04 and the ER treatment notes with the AEM fax cover sheet. In the comments, suspected COVID-19 is added. Scenario 4. Office visit. Mary has a doctor's appointment because she thinks she has symptoms consistent with COVID-19. She is treated for her respiratory symptoms and is referred to the mobile drive-thru for COVID-19 testing. She applies for AEM via Washington Health Fund Finder. What are the next steps in the process? Mary submits the physician treatment notes with the AEM fax cover sheet and makes sure the COVID-19 checkbox is selected. Terminations. Coverage is reinstated for any Apple Health recipients when coverage was closed on or after March 18, 2020, unless the individual has requested closure, is no longer a Washington State resident, or is deceased. This does not include all individuals with a pay-through date of March 31, 2020. Most individuals should discharge termination notices dated on or after March 18th until further notice. Additionally, during this time, individuals are not required to submit requester information to maintain their coverage. Individuals who are homeless and have been closed for whereabouts unknown will have their coverage reinstated based on their attestation of their current circumstances. Let's review some scenarios. Scenario 1. Mary's Apple Health was terminated on March 10th due to a reported increase in income. Her coverage will end on March 31st. Can her Apple Health be reinstated? No. Although Mary's benefits end on March 31st, action was taken to terminate her coverage before March 18th, when the CARES Act went into effect. Her case cannot be reinstated, and she will have to reapply when her circumstances change. Scenario 2. Albert turned 65 on April 1st. His Apple Health was terminated effective April 30th because he is now eligible for Medicare. Can his Apple Health be reinstated? Yes, because Albert's birthday and termination happened after March 18th, when the CARES Act went into effect. His Apple Health can be reinstated through the end of the emergency. Scenario 3. Karen moved from Washington to Idaho on March 18th. When she called to update her address, her Apple Health coverage was terminated for residency. This action occurred after March 18 when the CARES Act went into effect. Should her coverage be reinstated? No. Karen is no longer a Washington State resident and should apply for benefits in her new state. The CARES Act allows termination due to residency. Scenario 4. On March 19th, Angela called customer service to request termination of her benefits. This change was made after March 18th when the CARES Act went into effect. Should her coverage be reinstated? No. Termination of benefits due to the client's request is an allowable circumstance under the CARES Act. Angela's coverage should not be reinstated. Renewals. Healthcare Authority will be extending Apple Health coverage to households who have a renewal due in March or April. Self-Attestation is being accepted for non-MAGI applications and renewals. If an individual was closed in March for no renewal, coverage will automatically be reinstated. CHIP premiums. Premiums for Apple Health for Kids with premiums or CHIP coverage have been waived for the month of May. If an individual has been affected by COVID-19, they may request their unpaid CHIP premium be written off. If they are unable to pay the CHIP premium, or not currently eligible for CHIP due to past due premium payments. Individuals can call 1-800-562-3022 to request their premiums to be waived. HWD premiums. Premiums for HWD coverage are waived for April, May, and June. If an HWD recipient had a reduction of income, lost a job due to the COVID-19 emergency, they may request their unpaid premiums to be written off to maintain coverage during the emergency period. Call 1-800-871-9275 for more information. If they are also receiving long-term services and supports, contact their public benefit specialist at DSHS Aging and Long-Term Support Administration. There are many resources available to stay informed on COVID-19 and other Apple Health topics. For more information on COVID-19 updates, please visit the Healthcare Authority webpage. Individuals can also stay informed by visiting the Healthcare Authority Stakeholder Training and Education webpage. Healthcare Authority has made available Apple Health eligibility policy representatives. These representatives serve specific areas. For more information on the Alien Emergency Medical Program, please visit the last link on this slide. Individuals who do not have healthcare coverage, Apple Health, may be available. Individuals applying for Apple Health coverage can submit their application via online at www.wahelplinefinder.org, phone, mobile, or paper application. Staff at the DSHS determine eligibility for Apple Health programs for individuals who are age, blind, disabled. Applications for these programs can be submitted online through www.washingtonconnections.org, mail, fax, or phone number at 1-877-501-2233. Thank you so much for taking the time to view this presentation.